I'm going to talk thyroid today and just some different facts about thyroid because we can't look at just the thyroid. We got to look at things that affect the thyroid. So, number one, the nutrients of the thyroid that we need for the thyroid to function properly: zinc, iodine. Iodine's the big one. Iodine's more iodine in the thyroid than anywhere else. Second most place, female breast. Third most, female ovary. E, iron, B2, B3, vitamin C, vitamin D. Thyroid needs all of them. So you can get a lot of those from foods. When there's deficiency on a patient's got thyroid problems, we give a food supplement many times to build it up quick. And so never take the synthetic vitamins. They do not do what I'm talking about. The things that inhibit hormone production, well, celiac disease can. Fluoride. Fluoride's a bad boy. The American Dental Association thinks it's the greatest thing on earth. They're completely wrong about that. I did something on fluoride on my YouTube channel. You can scroll down and see it. Shocking how bad fluoride is. Infection, trauma, radiation, toxins, and stress. Stress is big when it comes to the thyroid. So T4 converts to T3, T4 converts to RT3, and we got to look at this in each individual patient, what's going on. So if they're stressed, this T4 converts to T3. This is the gas. That's the gas. T4 converts to RT3. That's the brake. So that's the brake of the body. So if we get stressed, it stops some of this conversion, and it causes more RT3, and suddenly the person has more brake than gas. So that's what stress does, and that causes a big problem. So if we're talking about increasing cell sensitivity to the thyroid hormones, so the cells are more sensitive, one, look at this, exercise. Exercise is good for anything. I'm going to pick up my wife in a few minutes, and we're going to go to the gym. We got to exercise, especially as you get older. You got to keep that muscle tone. But, so far as Alzheimer's, dementia, they're saying that starting to exercise even early on in life creates a decreased chance of those diseases down the road. So vitamin A, and then of course zinc. Zinc, again, is a big player. It's a big player in the body altogether. So conversion from T4 to T3, we need selenium. And again, these are from foods or food supplements, whole food supplements. So zinc, don't go out and get zinc picolinate. That stuff's no good at all. You got to get it from foods. Pumpkin seeds, you can get it from food supplements. And a food supplement is just a supplement that's concentrated food. So they take out the water, they take out the fiber, they concentrate it, so you're getting way more than you could get in just sitting down and eating, trying to get zinc from your food. So that's why we use those. So look at this. When it comes to T4 to RT3, what's going to affect this? Stress, liver, kidney problems. So we got to look at the lab work. Toxins, medications, trauma, not eating enough food can cause a problem with that conversion. Because we got to get both, okay? So we can't have all gas and all brake. We got to get both. Inflammation. So you can go and just take a medication and, well, I didn't write that down. Affect TSH, which is a pituitary hormone, not a thyroid hormone. And here's the pituitary, here's the thyroid. TSH tells this to make those. And so you can do that and just change TSH, but you don't fix this. You don't fix this problem. So that's what we do, is we look at the body always on everything. Look at the body as a whole. What's affecting it? What can we do to bring the body to optimal? Because in the body, there's things we do to make the body see what optimal is. Because if the body no longer knows what optimal is, how can the body get to optimal? So there's things we give to say, hey, this is what optimal is, so we're going to get to optimal. So if you have a thyroid problem, this is great stuff for you to know. Again, don't go just getting these vitamins in synthetic form. That's not going to be of any big help. So you take a synthetic vitamin, you rob other components of nutrition from the body.